Hello and welcome. You've tuned into the Behavioral Health Matters podcast, brought to you by Magellan Behavioral Health of Pennsylvania. This is the place where we dedicate ourselves to fostering positive mental health, building a greater understanding of behavioral health topics and services, and breaking down the wall of stigma. My name is John Lees, and I'm your host. I'm also the member and family advocate for Magellan of Pennsylvania, here in the Lehigh Valley. On this episode, we dive into a vital area of wellness, tobacco recovery. Joining the conversation is our special guest, Andrew O'Brien, who directs outpatient services and the internship program at the Penndel Mental Health Center in Bucks County. Andrew will share his insights and expertise on this important topic and help walk us through the path to recovery. And be sure to stick around for the end of this episode, and we'll tell you how to share your feedback about the podcast and make suggestions for future episodes. And now, here's my conversation with Andrew O'Brien.
Hello there, Andrew. Welcome, and thank you so much for joining us for this episode of the Behavioral Health Matters podcast.
Thanks for having me.
Absolutely, we're thrilled. So, if you could, can you provide the listeners with a little bit about your background and specifically the number of years you focused on tobacco recovery? And in addition, if you could share a little bit about your current role at Penndel Mental Health Center.
Yeah, sure. I would be happy to. So I am a licensed professional counselor. I'm also a certified advanced alcohol and other drug counselor, certified clinical supervisor, and I have a few tobacco treatment certifications. I've been in the therapy world for 15 plus years and mostly working with the co-occurring population. And when I say co-occurring, I'm talking about mental health and substance use disorders. And specifically with tobacco, it's been about 11 years. Then I've integrated that into my work. And it is one of my primary interests as far as treatment specifically with the co-occurring population. And we'll talk more about why. But that is one of my primary focuses. As far as what I do here at Penndel, I am the director of outpatient services here, and I oversee, all of the programs to an extent, and I'm primarily focused on the co-occurring program that we have here. We have we're dually licensed, so we treat both mental health and substance use disorders, and I also oversee our outpatient internship program. For master's level trainees who are mostly going to become licensed professional counselors. They're in grad school, and they are doing their clinical practicum and internship with us.
That's great. And that part of the job must be very rewarding to be able to mentor and coach those kind of coming into the field and share your wisdom and experience.
Yeah, I can say that I absolutely love what I do. And in all facets, and I do, this position affords me the opportunity to do a little bit of everything that I enjoy, which is nice. So part of that, training the next generation, providing direct care, training, supervisees, whether they be pre-licensed, even post-license. So yeah, there's a lot of different opportunities here that I enjoy, but, all of the work honestly is rewarding. And it's great to be able to help, whether it be the people that come here for treatment or the staff that's helping them.
That's great. That's great. Wearing a lot of hats, certainly.
Right. Yeah.
So if you could share with our listeners a little bit about tobacco recovery efforts and in particular, maybe if we could learn a little bit about the idea of supports and how supports have grown over the years and strengthened. And then, if you could talk a little bit more about, where your passion for supporting tobacco recovery efforts comes from.
Sure. So I think we are living in a really great time when it comes to a focus on tobacco treatment. In my experience, we are now where it's at really an all-time high of the focus that is placed and the importance that's placed on addressing tobacco use. Which has not always been the case. Historically, I think that we have, as the mental health, behavioral health, substance use treatment providers, we haven't always done a great job of addressing tobacco. Unfortunately, there's a bit of a myth that still persists, but it's getting less, that tobacco use in recovery actually helps people stay sober from other substances. And we know that that is not true. Research shows us that if people work on tobacco, gaining freedom from tobacco, that's the phrase that I like to use. I don't use the quit word. It's very emotionally charged for people. But, it's some people use it. I choose not to. So if people work on gaining freedom from tobacco at the same time as other substances, they actually do better in recovery across the board. Whereas the old belief was that they're more likely to relapse onto, whatever it might be, alcohol, opioids, stimulants. But that's not what we see. And research has supported that. One large meta-analysis looked at that there could be up to a 25% increase in sobriety and sustaining recovery across substances when you're working on tobacco. And what I like to tell people is there is no evidence that suggests that working on tobacco concurrently with other substances harms your recovery from those other substances. But I think we're getting there. There's a lot of great nationwide work, but in particular in Pennsylvania, the statewide tobacco recovery initiative, so tobacco-free recovery initiative, I've been a part of for several years now, probably going on somewhere between 3 and 5 years. And the efforts that initiative does is fabulous because they've been able to bring tobacco-specific trainings onto DDAP's training platform, which there never was before. So it's really integrating into the work that people are already doing. The MCOs, so the managed care organizations now, this has been for many years now, cover nicotine replacement, prescriptions for nicotine replacement. They'll cover things like varenicline, which is known as, the brand name is Chantix, which is a specific cessation medication, which is great because, a lot of the times, one of the barriers that I have seen is the cost of over-the-counter nicotine replacement. To go and buy a box of patches, it could be $20, $30 a box, depending upon where you're buying them. And though, yes, cigarettes are, more expensive than that, but you're buying them as you go along, or you're also getting them from other people. So it's not always that you have to put that much money out in the first place. So lowering that barrier has been great. Also, the efforts of the Quit line in Pennsylvania, which you can access by calling 1-800-QUIT-NOW, has really ramped up in marketing campaigns, media campaigns, to really raise awareness and support people in the in their tobacco recovery efforts. When you call the Quit line, you get access to telephonic coaching as well as nicotine replacement for free that they'll send to you. And we know that using medications for tobacco treatment is very helpful, and it is strongly encouraged, along with support and counseling. So I really think we live in a great time, and more providers are integrating it into what they already do, as opposed to looking at it as a carved out separate service. And when you think about it, I'll be real honest with you. Change is change. No matter what we're changing, we're going through similar process. And what I will tell people is we're not reinventing the wheel when it comes to addressing tobacco. All the coping skills that you use for any other, addiction that you're working on, unless it's to go smoke a cigarette, can be used in tobacco recovery. So I think it was at one time really viewed as this foreign concept that was separate. And through the efforts of many folks nationwide and in this Commonwealth have really helped to reduce that and have people realize that they can easily integrate it into their efforts. and what they're already doing. So I think that there's a lot of strong support. I think that more and more evidence is coming forward, and the focus is being placed on tobacco where it wasn't before. So I also would like just to say, if I can quickly, that we still, in the United States alone, lose close to 500,000 people per year directly related to tobacco use. So they're dying because of their tobacco use. So that's a staggering number. And it is, in some ways, has been a silent epidemic for many, many years. And that the cover is now, I think, mostly being, removed from that and being addressed. And it's so desperately needed. And especially because the most vulnerable populations use tobacco at a much higher rate, which we can certainly get into whenever, you would like. But it is a disproportionate burden on these populations.
So it's interesting, and I'm glad to hear that the times we're in now, there's a different perspective on it and different practices related to it. And I'm, really intrigued to learn more about that and some of the outcomes, that you're seeing in the work that you all are doing. And now that we've got a little more background, if we could shift gears a little bit, just to talk a bit about data, and specifically data around tobacco recovery, and see where we're at right now in 2025. So what is the data saying about tobacco use currently versus in prior years? And you kind of touched on this, but would you say we're seeing a downward trend, an upward trend? Where are we at currently?
So with the most up-to-date data that we're looking at, and remember, quality data is usually a few years behind. Right. So we're looking at data mostly from 2019 to 2022. But the data shows that there is indications of a decrease. Now, when we take a look at the statistics, the general population, so when you don't factor in things like serious and persistent mental illness or substance use disorders, the general population is at an all-time low as far as smoking prevalence. So it's significantly better when you look at the general population. Now, with the youth in the nation, tobacco use has decreased as well, and very popular with youth are e-cigarettes. Any type of vaping device, just lump them under e-cigarette. And it seems to be that there was certainly there's been a decrease over the years, which is great. There's still use among youth, and the e-cigarettes remain the most popular tobacco product among the youth of the nation. When we look at specifically prevalence rate among adults, the highest prevalence rate for e-cigarette use and vaping products is between the ages of 18 to 24. Okay. That's the highest rate in that age bracket. And then for combustible products, so when we talk about combustible products, we're talking about cigarettes and smoking, lighting a cigarette and smoking, that's the combustion. The highest prevalence rate there is between the ages of 45 and 64. So between age 45 to 64, those are the highest rates. Now, when we get into the population that we consider, the mental health population, if you will, that's where the numbers start to change drastically. We know that, the stats are anywhere between 36% to 50% of the mental health population use tobacco and largely are smokers. And that is significantly higher than the general population, which sits around like maybe about 14% or so of the general population, compared to even if it's just 36%, which I think it's higher. In my experience, it's probably closer to 50%. So that's a disproportionate number there because the mental health population is a quarter of the general population. So I don't want to go too deep and start getting lost in the numbers, but there is some indication that there's some decreases, but they are less drastic than with the general population. When it comes to the substance use disorder population, the rates are historically have been anywhere between 70 to 90% of the substance use disorder population are tobacco users.
Wow.
And that is a staggering number. Again, what I talked about earlier with that myth that has persisted for many, many years, it tends to make sense why there's such a high rate of tobacco use. Now, there's also an interesting component with tobacco use among substance use disorders of people having never smoked until they go into treatment, and then they become smokers. So it's a very that's something that we don't talk a whole lot about. But I've experienced many people that haven't never smoked a day in their life until they went to, say, a residential treatment facility, and then everybody around them smoking, and they start smoking. So it's definitely a significant problem when it comes to substance use disorders. We also know that there is an interaction between tobacco use and other substances, and in part we know that nicotine, which is the primary chemical that leads to the addiction, that leads to the dependence, the physical dependence, the psychological dependence. When that is on board first, subsequent substances, for example, it's strongest with other stimulants because nicotine is a stimulant, and it's also powerful with alcohol, for example, that those substances used later, the brain will respond in a more efficient way to, because it's been primed by the nicotine, because they're activating the same exact parts of the brain. So pharmacologists who study chemicals have said that they couldn't develop a more perfect drug to hijack the dopamine reward circuit in the brain than nicotine. And when you look at, furthermore, for me, having worked pretty much my entire career in the co-occurring population, we talk so much about persons, places, and things, right? And talking about, stay away from this area where you used to use, stay away from these people who you use with. But for so long, we never addressed the thing that's in the pocket of these folks all the time. And they were smoking while they were using other substances. So how could it not be a trigger? Right. And that the hand-to-mouth behavior and some of the same paraphernalia is used for smoking as in other substances. I mean, there's even songs that reference only smoking when you drink. I mean, there's a powerful connection there. So when we look at these efforts and the prevalence in the smoking in the substance use disorder population, it starts to make sense when we see what some of the beliefs have been. Furthermore, when it comes to mental health, very higher prevalence rate with depression, anxiety, and then also we know with psychotic disorders there is a very high prevalence rate, sometimes up into the 80%, that are using tobacco. When I work with folks who talk about anxiety, they'll reference tobacco as being helpful for their stress and for their anxiety. And a lot of the times what we're talking about here is that they're, one, treating withdrawal anxiety, and it just seems like the anxiety is getting better because the withdrawal anxiety decreases when they redose by smoking. We're just going to focus on smoking for this, but we'll talk about the same applies for smokeless tobacco users and in some indications with folks that use e-devices. But when they redose, that withdrawal anxiety decreases, so it's helping with my anxiety. The other thing that I like to tell people is when a person smokes, they are doing a deep breathing exercise. They're just doing it with a very toxic, toxic chemicals and fumes. But it's very rhythmic. Inhale, hold, and then they exhale. What does that sound like? It's a breathing exercise.
Yeah, I was just going to say it's almost like a breathing activity. You might work with someone around, helping to reduce stress or anxiety in the moment and create a state of relaxed, a relaxed state, right?
Yeah, exactly. Yeah. And they have time carved out, maybe, or if you're doing it with other people, it becomes a social piece.
Almost like a ritual.
Exactly.
Ritualized things at this time of day. This is where we go, and This is what we do. And
yeah.
And now a brief word from Magellan of Pennsylvania. If you or someone you care about is a Magellan of Pennsylvania member, and you have any questions about your behavioral health or substance use services, please visit us online at www.magellanofpa.com for all the information you need. That's www.magellanofpa.com. And now, back to the show.
I'm interested if you could highlight that connection a little bit more for those who use substances versus those who don't use substances, and any of the trends you're seeing in how substance use or tobacco use are linked to other health risks. And you kind of talked a little bit about this, but specifically, some more of the risks to one's health.
Yeah, so it's a great question. And, in as I was just saying, there's a much higher prevalence rate for smoking among those who are using other substances. And the amount that's smoked tends to be higher as well. So the impact that tobacco smoke has on people's health is profound. There's not a system in the body that's not affected. It's not helping anything. It's just harming. And, when we take a look at the physical implications, the number, by and large, the number one physical health disease linked to tobacco use is heart disease. And, a lot of times people think it's lung cancer, which is up there as well, especially for tobacco combustible products. But heart disease is the primary, and heart disease is, known as the silent killer in the United States, and perhaps around the world. But even lesser things, difficulty breathing, lung functioning, being able to go up a set of steps without being, winded or, struggling to catch your breath, to, more frequent colds, more frequent cases of bronchitis because of the lungs' decreased capacity to clear out foreign objects, and all the way to COPD, emphysema, various forms of cancer, lung, oral, bladder, and these type 2 diabetes. It has a significant impact on type 2 diabetes. The CDC came out, and I believe it was 2016, and said that smoking alone is enough of an etiological factor for the development of type 2 diabetes. We don't typically see that. It's not just smoking. There's other factors as well, but it significantly impacts type 2 diabetes, even to when there are some surgeons who, unless it's an emergency, life-threatening condition, they won't operate until the person has stopped smoking because of the ability to clot. It affects the ability to clot. So the wide-reaching, the impact on health is significant. And one of the things that we know specifically about active addiction, so active substance use, is that healthcare is not necessarily a priority. And folks who are active in addiction are already, at a higher risk for health-related issues. And then we add on top of it the copious amounts of tobacco being used, it just compounds those issues even more. So it is a significant threat. And what I talk a lot about is that it's one of the most significant threats, if not the most significant threat, to people's overall wellness. Because we also know that people who are successful in gaining freedom from tobacco, interestingly enough, report decreased depressive symptoms, decreased anxiety symptoms, even decreased pain, decreased need for pain medication. People who are using medication for opioid use disorder report less dissatisfaction with their dose, report decreased need for increases in their dose. So there's a lot of benefits for gaining freedom from tobacco that are there, and significant risks across the board for continued tobacco use.
So it's obviously the health risks are significant and profound, as you said, but the benefits of being able to stop smoking, obviously, there's real information, real evidence that people will report, just feeling better overall, not just physically, but also emotionally and in other ways as well.
Absolutely. Yeah. And some of the risks, some of the physical effects, progress is seen very quickly from once, full cessation is achieved. Matter of hours to weeks to start seeing some, improvement in cardiac functioning, lung functioning. We start to see these things relatively quickly. So, and when people get to, the acute withdrawal period for nicotine, so that's when the body is most, craving the substance, is about 3 weeks. So that's a long time when you're struggling, which is one of the reasons that we strongly recommend medication, because that is specifically aimed at reducing felt withdrawal. And, one of the main reasons that people return to use is felt withdrawal, because nobody wants to feel terrible. It's not
so the person doesn't feel well as they're going.
Oh, they feel terrible.
So the medication can help to reduce those symptoms of the withdrawal and help them through that first, it sounds like, block of time that's so critical to. I tell people about a month. Give it about a month, and then you'll start to really feel and notice the differences. And it doesn't become easy, but it becomes easier than it was on day one. Sure.
So, but the reversal of those physical health, risks start to reverse pretty quickly.
Yeah. Okay. Well, let's shift gears a little bit more again, and if we could talk a little bit about some of the feedback in general, and more specifically, if we could focus on individual recommendations regarding tobacco recovery. So, what do people share with you about some of their fears? And we just kind of touched on it. Well, it could be the discomfort of stopping and the challenges there. But as they're contemplating, working on tobacco recovery, how do you handle those kind of challenging conversations, helping to kind of talk folks through that, focusing on stopping all at once versus maybe slowly cutting back on tobacco use and so forth?
So it's a great question, and there's a lot of fear. The number one issue that I see that gets in the way of people working on tobacco, or even providers talking to people about their tobacco use, is fear. And one of the things that I've found with individuals who are smoking, there's always exceptions to this. Don't get me wrong; it's not everybody. But a lot of the people who are smoking don't even like it anymore. They just keep doing it. They don't. Sometimes they say, I don't even know why.
So almost on like an autopilot.
Yes.
Kind of.
Absolutely. Yeah. You'll talk to people who have spent some time out of community in a non-permissive environment. So, for example, like a hospital, if they're in a hospital, whether it be for physical health or psychiatric, reasons, spend time in the hospital. Can't smoke in hospitals. Okay. they give you nicotine replacement, and people will say, like, I was fine. I was totally fine. I didn't have any cravings, didn't have any urges, none of that was fine. I was discharged. The next thing I know is at, the convenience store buying a pack of cigarettes. So I think people are afraid to attempt because they don't think they're going to be successful. And a lot of the times people they'll try, and then they find, one of the big thing is cold turkey. You can't see me, but I'm doing air quotes. Cold turkey doesn't involve deli cuts. But the idea behind it is you're stopping and you're not going to use anything, no medication, nicotine replacement, anything like that. And we know that those success rates are between 1% to 3%. So if you line up 100 people, between 1 to 3 of them will be successful that way. So you're not really setting yourself up for success. And then you find that you are going back to smoking, and then they feel like a failure and that they can't do it. So when I went through my first tobacco specialist, treatment specialist training, I remember the lead trainer, the physician, talked about in his experience, people are not using enough nicotine replacement, and they're not using it for long enough, right? Mm-hmm. So then they start to, they're not successful because they're starting to have the cravings again, and they haven't been able to wean down over enough time to be able to reduce those felt withdrawal symptoms to a manageable level that they don't need the assistance of nicotine replacement. For example, I'm just going to use that for our purposes right now. So then they feel like they failed. And the biggest thing that I want to address to individuals who are struggling with tobacco use and would like to gain freedom from tobacco is keep trying to stop. Don't give up, because every time you attempt to gain, freedom from tobacco, you learn something, and you gain what we're going to refer to as recovery capital skills here. Okay. Every time. And also what I would like to say to providers is, just like what the Commonwealth of Pennsylvania says in their every smoker, every time training, have the conversation, keep the conversation going, but don't tell people to quit. That doesn't work. Okay. Mm-hmm. You think you're the first person that has told them to quit. You're not. Have a conversation with them about tobacco. See where they are, see what their thoughts are, see how they're doing with it. And just keep that conversation going, because you never know when that person's motivation will grow to a sufficient level to want to start working on this. You also may not be the provider that sees that change, but you're planting seeds for later down the road.
And helping them to identify those skills each time they try, right?
Absolutely. Yeah.
And on that point, you had mentioned earlier, many people who are smoking, particularly for a number of years, don't want to. They do want to stop, right?
They do. Yeah.
So it's not that they necessarily lack motivation. It sounds like it's building on those skills you identified, right? And going through that process, and then with that support, and I think you mentioned it was the medication for long enough, and to kind of stay with that, and that.
Yeah.
So I imagine a lot of those conversations early on are very critical, and making sure that they're aware that there's support that exists, particularly early on, as they kind of bridge from, smoking to or use of tobacco to stopping that, right?
Which is absolutely
critical time. It sounds like
it really is, and when we look at all forms of addiction, that's the critical period, right? And it doesn't matter what we're looking at. If we're looking at substance-based, we're looking at gambling, whatever it might be, that early period is the most crucial time, because that is going to be one of the toughest times during the recovery journey. But we need to tell people, one, they can do it. People are able to gain freedom from tobacco. It happens all the time. People who have a history of substance use disorders are able to do it. People with mental health struggles are able to do it. It may take longer, and it may take more efforts and more attempts, but it is possible, and people do it all the time. So really, to instill that hope that it is possible and that they can do it, but to encourage the use of nicotine replacement, have them talk to their prescriber about something like varenicline, and talk about the quit line, talk about support, talk about counseling, talk about coping skills. There are even Nicotine Anonymous meetings that people can attend, which is 12-step for tobacco.
I didn't know that. I didn't know they existed.
They do, yeah. And it's so there's people need to hear that it's possible.
And now, a brief word from Magellan of Pennsylvania. Are you tired of feeling unheard when it comes to your behavioral health services? If you or your child are a Magellan of Pennsylvania member, here's your chance to step up. Magellan is looking for members to serve on complaint and grievance panels. This isn't just a meeting, it's your opportunity to have a direct voice, review service issues, and actively improve the quality of the behavioral health system for everyone. You have the power to make a difference. Get involved today. To learn more, call John Botker at 877-769-9784. That number again is 877-769-9784. And now, back to the show.
If we could talk a little bit about the available resources, what are some of them, and you, like I said, you mentioned, I think it was a phone number folks can call, but what are some of the resources that you would recommend, and the supports that exist currently? And then if you could talk a little bit about your perspective on the value of these supports and resources, and then how folks can access them. You mentioned the phone, online. It sounds like in person, some kind of combination. What's the best practice there, or is there one? Is it individual?
Well, I think with most things, there are probably going to there's always best practices, but we want to find what's going to work for you. So when we talk about the quit line, for example, it's 1-800-QUIT-NOW. And you can also go on to PA Quit Logics if you Google PA Quit Logics. And that's the website base to get connected to the quit line, which will provide you support, telephonic coaching, and so phone calls with a tobacco coach, a trained tobacco coach, and also access to free nicotine replacement. I also encourage people to talk to your providers. Talk to talk to your primary care physician. If you're seeing your family doctor, talk to them. If you're seeing your psychiatrist, talk to the psychiatrist and see what their thoughts are and see what they think their best, approach would be. We talked earlier that the managed care organizations do cover nicotine replacement and medications for tobacco use disorder. So those resources are available. And also I think a great place to talk about this is with, and I'm biased because I am a therapist, but is, with your therapist, because that is a safe space. That's a supportive relationship that's already there. And it's an area where you can really explore your thoughts, your feelings, and, your motivation, what you want to see happen. And the therapist is, able to support you, talk about coping skills with you. So have the conversation and start it. Call the quit line, talk to your, doctors, talk to your therapists. I think it's the most important thing is to get that conversation started. And don't think it's not possible for you. I think that's the biggest hurdle for people to overcome, is that it is possible. and that the people do it all the time. So to recap, the Quit Line, I think is an awesome resource. I encourage providers on this call listening to this podcast, if you will, to look into the DDAP trainings that are out there. Look into tobacco trainings that are available. Find out the information, because the more information that you have, the easier it is to have the conversation with the person with whom you're working. And being able to have an informed, non-judgmental, supportive conversation. I'm going to talk directly to the therapists on here that are listening to this. You already know how to do this. You do it with every other issue that people talk to you about. So I would pursue that training and take a look at learning more about tobacco treatment.
And it sounds like, in that example, if someone's working with a therapist, this could be something that could be folded within a treatment plan that exists. So they may be working on other mental health or other types of recovery efforts.
Yeah.
I assume it could be kind of folded in as its own goal, perhaps, or underneath another goal, perhaps. But you mentioned that we're talking about overall wellness. So of course, having support around things that you're working on related to your overall wellness, would be a part that you want to incorporate in some fashion within a treatment plan.
Yes. And I'm glad that you brought that up, because for far too long, people thought of this as a separate service, a separate treatment. And really, it not only could it be integrated, it should be integrated, because we really want to look at, and this is something that the MCOs and that Magellan supports significantly, is integrated care. So really that integrative look at the person. It's not just physical, it's not just mental health, it's whole health, whole wellness. So it should be integrated in. I'm just going to put that out there. I'll take that bold stance. It should be. And when you look at it, can it be a separate goal? Sure. Does it have to be? I don't know. It maybe not. If you're working on substance use or any other issue within a course of treatment, you can integrate it into what you're already doing, make it a separate goal, but have the conversation.
Yeah.
Have the conversation.
Sounds like that's really the critical takeaway, is that communication related to this, and helping to reassure people that there's an understanding of just how challenging it is and how much contemplation, has probably gone into it. And kind of along those lines, if someone's interested in getting started, but not quite sure how to do this, and you kind of already have kind of walked us through this, but is there any key step to take or to not take, or just to be aware of, in terms of what your recommendations would be to help someone get started on the path towards tobacco recovery? And then on top of that, if it's maybe not you specifically who, let's say, is listening to this episode, but maybe you have a friend or a family member you'd like to help on this path, how can they handle this kind of a conversation, which I imagine could be somewhat, sensitive or tricky, and you want to make sure that they're, most helpful, right?
Yeah. I think that the best approach when you're supporting anyone through any difficult situation is try to be as non-judgmental as possible. Okay. Try to be as supportive as you can be. And don't try to make anybody do anything. Try to support them in what they want to do. But at the same time, provide them resources. If it's a loved one, express your concern, express your, this is coming from a place of caring. This is coming from a place of love. It's not coming from a place of judgment. It's not coming from a place of that they're a bad person. It's coming from a place of deep concern and love for them. And I think that those conversations, when they are when they're framed that way and approached that way, tend to go better. You tend to get less defensive reactivity from the person with, that you're having the conversation with. The person going into the conversation doesn't feel that they need to be, on the offense to prove the point that tobacco is going to kill you. They know tobacco is harmful for them. Most people.
And we already know that they, in most cases, want to stop.
Exactly.
So having someone outreach to them or reach out to them to express support, I would imagine would be, again, it's that those protective factors in our life. What can we look at in the way of supports and strengths from that perspective? And if we've got someone who's, helping us to get started and be there with us along the way, I imagine that could be, one of those protective factors for someone as they move forward.
And now, a quick word about a free confidential resource that can help you take the next step toward a tobacco-free life. If you or someone you care about is ready to explore tobacco recovery, the PA Free Quit line is here for you. Quitting is a journey, and they can support you through every single step. It's free, convenient, safe, and secure. Ready to learn more? Call 1-800-QUIT-NOW. That's 1-800-784-8669. You can also visit paquitlogics.org to enroll online and explore their services. That's pa.quitlogics.org. And now, back to the show.
For providers listening, a great place to start is the Commonwealth's Every Smoker, Every Time training, which you can Google that and sign up for that. Going on to DDAP's training platform and looking at the tobacco trainings that are available on there. I know the folks that created them, and they're fabulous. They know their stuff. And I think it's a real good place to start. And the more information, in my opinion, information is key. Because who goes and buys a car just because you like the color? If you do, you probably should, right? You should look into its safety profile. You should look into its gas mileage, all these different things. You want to be informed. So as a provider, get the information, get informed, and then you can offer that information to the folks with whom you're working. And when we have better information, we tend to have better outcomes.
Yeah, and I think that's a great message for all, really, is about the communication and making sure that we're doing everything we can to learn. And as you said, have as much information as possible on the individual side, so that they can make informed choices and, identify, what support they're seeking out. And on the provider side, to know what exists and to be able to, promote that work and ideally be as, helpful as possible as folks, begin on the path and continue on the path.
Yeah. And one of the things I would like to say, I've done in part of my background also is providing trainings to providers on tobacco treatment. And when I'm doing that, I like to use the analogy that if you came in to an office one day, let's say you went to see whichever provider you're going to see, your doctor, and your doctor says, you know what, those shoes that you're wearing, they're bad for you. They're going to kill you. You got to stop wearing those shoes. Now, if it's the summer and you're at the beach, you're probably not going to mind. Mm-hmm. But when it's February and it's, -3 degrees outside and there's ice on the ground, or it's July and it's 100 and the blacktop is 200 degrees, you're going to want shoes then. So remember that folks who you're going to encounter who are smoking, using tobacco, have used tobacco for a long time on average. Oftentimes, it's the first substance that we see people have started to use regularly. So to them, it's as normal as wearing shoes. So one of the reasons why people are so hesitant to look at it and to address it is because it's been part of their normal life for so long. Yeah. It's a foreign concept to stop doing something that you've been doing for so long. And this is something that oftentimes they want to stop. But, this is an addiction and this is tough. But I use the shoe analogy because I think it's something that most people can relate to. I mean, I've been wearing shoes my entire life, and if somebody told me to stop it, I'd think, I don't know about this, But so it's important to keep in mind that folks have been doing this oftentimes for a long time, and it's going to take time to be successful in establishing and maintaining recovery. It takes time, and that's okay, because it's better to take time to get there than not get there at all. But keep trying.
Yeah, it's a great message, and a great way to kind of describe some of the challenge inherent in contemplating and moving forward with making the change.
Yeah.
So one of the goals of this podcast is to help reduce stigma through these conversations. So do a small part by having conversations about topics that can help people to learn information and move forward. And so, I'm interested to get your perspective. We ask each of our guests their perspective around stigma, and over the arc of your time doing this, whether you've seen any improvement in just overall the reduction of stigma, but certainly as it relates to mental health, substance use, and then tobacco recovery in particular.
Yeah, that's a great question. I believe the answer is yes, that we have seen a reduction. I think the concept of mental health care and therapy, in particular, psychotherapy in particular, is so mainstream now. So I think that the acceptance of that care has really grown. And I think that we are seeing that mental health and substance use struggles are not a failure of will. It's not a moral defect. Okay. And I think that is getting much better, at least from my perspective and what I see. I'm probably biased because of what I do for a living, right? But I do believe it's getting better through efforts, through education campaigns, through general awareness. I do think it's getting better. Do we still have a ways to go? Yes. The shame that is associated with active addiction in particular is a significant issue. And tobacco in particular, I think the shame is a real potential barrier. And I also think that one of the things that happens with tobacco in particular is it's not always been viewed as an addiction. It's been viewed as a habit. And it's gotten minimized to the point where I think a lot of the times people think, well, just stop buying the cigarettes. What's wrong with you? Just stop buying, right? And now, don't get me wrong. People think that about other substances as well, and gambling. Just stop doing it, right? But with tobacco, I think it's changing because like what we talked about earlier, that it's really starting to be seen and viewed as an addiction. But that shame of feeling like, what's wrong with me? Why am I so weak? Right? If I were only more strong-willed or strong-minded, if you will. These are things I've heard from people saying, if I could only. And that's a shame, because that's, one, it's not what it's about. And two, that increases that shame and that stigma associated with it. So I think that we've come a long way in many areas, but I think that in particular with tobacco, it's probably a little bit behind that curve. And, the other piece of it, which this is a bit of a catch-22, because tobacco use is not as accepted in society now as it used to be. I can remember, as I'm sure you can, about going into a restaurant, in the past, and the smoking section was separated by a half wall, from the non-smoking section.
Right.
One time people used to be able to smoke on airplanes. Can you imagine what that, I never experienced that one, but I can't even imagine what that would have been like. But it's much less accepted in society now, which is good because people are understanding the risks and the harm to it. Philadelphia County had required all bars to go smoke free, in part because of the secondhand risk to the bartenders and the wait staff, because secondhand smoke is incredibly dangerous. So society has kind of pushed it out of the main light, but then the other side of that the other side of that edge of that blade is that can increase the shame that people have and ostracize and that stigma if you are still using tobacco. So I think we've got a ways to go, but I think we're getting better because we are getting the word out there that this is not just a habit that people aren't strong enough to stop. This is an addiction that really is complicated to address. Addiction is not it is not without its complexities, and I think that's changing, and I think will help go a long way with the stigma and the shame associated. But I think overall we're in a better place than we ever were. But I think there's still a ways to go.
Well, I'm certainly glad to hear we're making progress. That certainly is something that kind of lifts me up and gives me a lot of hope. But it sounds like there's certainly more work to do. But it's good that folks like you are out there doing that work and supporting folks in this specific area. And that brings us to our final question, which we ask each of our guests, which is our one thing. So we've covered quite a bit of ground in the area of tobacco recovery, and I'm interested to know from you if there was one thing you'd want our listeners to walk away now knowing, having listened to this episode. What would that be? And again, I know we've covered a lot of ground, but if there was one key takeaway for our listeners, what would you say that is?
I'm going to break the rules a little bit, and I'm going to give you two key takeaways, but they're one thing, but for two different groups. So, to tobacco users, I would like to tell you that there is hope. You can do it, and to keep trying. It takes time, and oftentimes it takes many tries for people, but keep going. Keep trying. You can do it. To providers, I would like to say, keep the conversation going. Talk to people about tobacco. See where they are with things. Be supportive. And just keep that conversation going. And keep that conversation going past the point of, hey, are you ready you use tobacco? Yes. You ready to quit? No. And then the conversation ends. Let's not do that conversation anymore. And do your assessment. I get that part of it, but keep that conversation going. And do it in a way where you're supportive. And you're, showing care and concern. So those are my two one things.
Gotcha. Well, and I think those are not only great takeaways, but also wonderful, calls to action, particularly on the provider side of things, to be mindful, to continuously be asking that question and providing that support and open door for folks to know, hey, we can talk about this at any point. So, So it's a great message. And just wanted to pause at this point to say thank you very much for joining us for this episode, for all of the information you've shared, the work that you're out there doing. Really appreciate you taking the time to sit down with us and have this conversation.
Yeah, well, thank you. I think it's awesome that you guys, one, do this podcast, but two, you have included tobacco recovery in the podcast because it is it's a super important issue that we need to keep shining the light on it, and we need to keep talking about it. So I think you guys are doing awesome work there, and I thank you for the opportunity.
Yeah, thanks for saying that. I mean, it is part of the goal is, to have conversations related to these types of topics, to really promote the work that's going on, raise awareness, and ideally help folks to have conversations that may be helpful for them to move forward or others in their lives that they care about to move forward. So again, we greatly appreciate your coming on and having this conversation.
Well, thank you.
All right. We wish you all the best going forward as well. You take care.
Thanks, you too.
Stick around. We'll be right back to wrap things up. So what did we learn in this episode? Well, we took a deeper look at the growing emphasis on tobacco recovery today. And while overall tobacco use is trending down, we learned that individuals with mental health and substance use disorders continue to face higher rates of tobacco use. But the key takeaway was this: help is available. In Pennsylvania, you can reach out to the PA Free Quit line at 1-800-QUIT-NOW. You can also find incredible resources and support online at the statewide Tobacco Recovery Initiative website. That site is tobaccofreerecoverypa.com. And lastly, we learned that while recovery is a process, it is absolutely possible. We'd like to thank our guest, Andrew O'Brien, for joining us on this episode. We'd like to thank all of you for listening and invite you back for our next episode. If you have any questions or feedback about the podcast, or have suggestions for future episodes, we'd love to hear from you. Reach out to me directly and send me an email at jglees@magellanhealth.com. And if you enjoyed this episode, be sure to hit the like button and subscribe to our channel for more Behavioral Health Matters content. Well, there's the music letting us know we're out of time. I'm your host, John Lee, saying goodbye for now, but please remember, behavioral health matters.